Hi, everyone. Thanks so much for joining us today. This is our special live streamed event. It's called Achieving Our Best Health as We Age. My name is Kelly Beekler, and I'm the Chief Philanthropy Officer of Providence Foundations of Oregon. I really hope you're all staying safe and healthy, especially during the COVID-19 pandemic that's really affecting us all. At Providence, we understand the concern many feel when seeking treatment right now. While living through a pandemic is new to us all, some things are not. Providence and our caregivers remain wholly committed to your care and your safety. Whether you need attention for something minor or whether you have a major problem, we've put in place additional protocols to make sure you feel comfortable and confident every time you walk through our doors. If you need care, we are safe, and we are here, and we are open. So today's event will focus on how Providence's unique senior health program is helping seniors live their best lives, and also training our providers in caring for older adults using the strategy of what you'll learn about, the 4 M's. We'll have much more about them during this presentation. I'm looking forward to learning about such an important topic for all of us. The work of Providence Senior Health is made possible in a large part by our generous donors. I'm very excited today to announce a major development. An anonymous couple recently committed to a gift of $400,000. They want to launch a program called Dementia Pathways. This program will help to more accurately diagnose patients with dementia, help providers better care for these special patients, and provide ongoing support for families and caregivers of patients living with dementia. This gift is emblematic of what Providence does best with philanthropy, augmenting exceptional patient care with additional resources to help advance services to care for patients, research, and wellness. So thank you to these special donors and to everyone, so many of you who support Providence. Your gifts truly make a difference for us all. Now, I've known today's speaker for a long time. Dr. Marion Hodges was one of the first people I met when I came to Providence many years ago. Dr. Hodges is the Bain Chair of Geriatric Medicine and Regional Medical Director of the Senior Health Program for Providence in Oregon. She is a physician who deeply cares about patients as they age, whether they struggle with dementia or other chronic illness, or seemingly sailing through the aging process. She chose geriatric medicine so she could care for patients with the way she wanted her parents to be cared for, the way I want my parents to be cared for. She's an expert in the field, and she is a compassionate caregiver at her core. Dr. Hodges, thank you so much for joining me today. I'd just like you to begin, introduce yourself, tell us a little bit about your background, your role at Providence. Thanks for being here.
Wow, Kelly, thank you. And it's great to be here. This is really exciting talking to you, even if we're doing this virtually. This is fun. So as Kelly said, I'm a geriatrician. And after my training in internal medicine and geriatrics, I came to Providence, and I've been here my entire career, which is now 28 years. For most of that career at Providence, I've been what we call a clinician educator. So I've had a part-time private practice over at the PPMC campus, and I've been teaching young doctors, mostly PPMC internal medicine residents, but I've also been teaching St. Vincent and Milwaukee residents. And as Kelly also said, for the last 6 years, I've been really privileged to hold the Bain Chair of Geriatric Medicine, as well as to be our medical director for senior health for Providence, Oregon. And it's just been a wonderful journey. So thank you for inviting me today.
Sure. Happy to have you here, and I'm looking forward to this discussion.
Yeah, me too.
We're just really going to have a discussion about some of the programs, some of the things going on in senior health today. So let's just jump right in. We also have experts who can answer questions that our viewers may have. So if you'd like to ask a question, you can send an email to Foundation Events. Now that's all one word, Foundation Events at providence.org. And Dr. Hodges and her team will do their best to answer each one. You may also post your questions in the chat. So as we're doing this, post your questions, and we'll be answering them as we go along. Let's jump in right away with question number one.
Okay.
With age-friendly care. And I've heard about, you've talked a little bit about the 4Ms, and I've been fascinated by the 4Ms. Why don't you start by defining these terms and just give us an overview of what they mean to you in your work, the 4Ms?
Yeah, sure. So I'm going to start with what is the age-friendly health system framework and what that's all about, and then that will take me to the 4Ms, which is the meat of it. So the age-friendly health system movement started about 4 years ago, launched by the John A. Hartford Foundation, which is a foundation really dedicated to improving care for seniors across America, and the Institute for Healthcare Improvement, which I'm sure some of our viewers have heard of. But that institute is experts in change and how do we change healthcare across our big country, which is very complicated. So what these two groups realized was care for seniors is not in America what it should be, and they wanted to focus on making it better. And experts in geriatrics came up with the 4Ms as the framework for helping us do that. And we have a slide, a little graph here, which will show that to you. But you can see what these 4Ms are on the slide. And I'm going to, for a second, Kelly, take us through each of the M's because they're more than just the words on the slide. So the what matters M, which we call our stretch M because it starts with a W, but you have the matters piece of that, which qualifies it as an M. The what matters is really the most important M. That is to understand not just what's on a patient's advance directives or certain paper documents that we fill towards the end of a senior's life, but actually what is most important to them. What do they value? What do they enjoy? What are they afraid of? What gives them quality of life? So rarely in medicine do we really delve into those conversations the way we should. And what this movement has taught us is that this is probably the most important thing that we can do for a senior as a primary care provider is to have a conversation about what matters to them. Because if we do, then we're much more likely to give them the care that is tailored to those values and the care that they want, as opposed to the care they may not want. So that's what matters. The M of medication is the M that focuses on obviously medications, but medications is really important for seniors because by and large, they're on too many. And we tend to just start medicines and as they get older, either not stop them or not change the dose. And so they're much more vulnerable as people age to having side effects, to even having hospitalizations and harmful things happen. So the M of medication is focused on taking away medicines and reducing doses and making their quality of life better as a result. The M of mentation focuses on some conditions more common in our seniors, such as dementia, which is when the brain doesn't work as well as it should, Alzheimer's and dementia from strokes being the most common, but also on depression, anxiety, conditions we commonly see in older adults. And all three of those conditions under mentation, seniors may not volunteer to us that they're struggling with changes in their brain. And it's important for us as clinicians to look for those conditions and to ask about them by asking the right questions. The last M is mobility. And really what that focuses on is function. The individual's ability to be independent. It's way bigger than your risk of falling, which is generally where we go when we think of mobility, but really it's about how can I stay as independent as long as possible and how can my healthcare providers help me? So those are the 4Ms. And what we know is that those 4Ms are way more important and way more pertinent to the care of seniors, especially over 75 and 80, than for our middle-aged adults. And so you're age-friendly as a health system if every time you encounter a senior, whether it's in the clinic or the hospital or the emergency room or in a rehab facility, that you're looking after all four of those M's. So Providence, Oregon was super lucky in 2017 when we were invited to be one of the pioneer health systems in the country, Kelly, to be asked to go on this age-friendly journey. And so we and 5 other health systems started that journey. We got a grant, and that began the work in my program, the senior health program, to really say, how can we delve into these 4 M's and make care for seniors in Providence, Oregon better? And that's been super exciting.
So that leads me right into my first question, or maybe my second question, but another question. How does senior health apply these 4 M's to become a more age-friendly organization?
Yeah. Well, it's complicated because we have so many clinicians, so many clinics and hospitals, and trying to get everybody up to speed is a challenge. So the way we've approached it is little by little. Let me give you some examples today, because I think that will really help. And the first example I'd like to talk about is actually the one I'm probably most proud of, and that is our Geriatric mini fellowship. What we have known forever is that there will never be enough geriatricians like me, enough geriatric nurse practitioners to serve all of our seniors across Providence, much less everywhere. And so what I've wanted to do for a long time as a teacher of young doctors is to geriatricize, if you will, primary care. And what that means is to take our primary care providers and give them the skills that they want and that they need to serve their older adult patients better. They know that they're often failing them and they could do a better job. And so we started in 2018 a 4-week program for primary care. We take about 6 to 7 clinicians each year. We've done this now 2 years. COVID kind of wrecked 2020 for us, but we did it in 2018 and 2019. And each week is devoted to, guess what? One of the M's, right? So we have 4 weeks, 4 M's. And so for that week, the primary care provider is released from their practice. They spend the entire week with their fellows, the group of 7, with me and my fellow teachers here in Portland. And it's a very interactive week. It's a challenging week. It's both lecture and exercises where they practice language and tools that we teach them. And then they've gone back to their clinics and they've taught their fellow doctors and nurse practitioners what they've learned. They've worked with their staff to try and change and improve practice. The reason I get so excited about this, Kelly, to be honest, is, I've been teaching 28 years. And in this fellowship, I think that we have really cracked an important nugget, because those doctors and nurse practitioners tell us that those 4 weeks have changed, transformed even. The word is they've used is transformed their practice, that they're now giving better care and they know it. And they're really focusing on what matters, and they find that has made their relationships deeper and more meaningful. So the fellowship has really helped to begin to build a foundation of age-friendly healthcare across Oregon that we only expect to continue.
Marion, how many people have participated in that in your fellowship so far?
Yeah, we've had 13 so far, 7 1 year and 6 the next. We're really hoping we can get back on track in 2021. We have doctors now on a waiting list to do this. So we know that it's resonating and it has a good reputation as being an educational bonus to be a part of this. So yeah, really exciting.
Okay. Very good. We're going to dive in now into the 4 M's a little deeper. You gave a nice overview, but I want to dig in a little bit more and find out a few more details. So I'm going to read through, I'm going to hit on each one of these M's and let you explain them a little bit more. Let's start with this concept of, it's an unusual word for me, mentation. So what is it? How are senior health providers addressing it? I'd love to hear.
Right. Well, this has been very near and dear to my heart, the whole idea of mentation, because as a geriatrician, many of my patients have dementia and many of their families are going on this journey. And Kelly, you and I really became most acquainted when I came to you 10 years ago and asked the foundation and you to help support me and my colleague, Ann Hill, the daughter of one of my patients, because we wanted to write a book to help families on this journey, to support them and guide them in ways that we didn't see in the literature available at that time. And so with foundation support, I know some of our listeners have heard of Help Is Here When Someone You Love Has Dementia, which has been, a wonderful thing. It's changed families, it's helped them. We now have it in Spanish, we have an audiobook, we have an ebook. It's a great tool. But a book is a tool and it's limited. And so as much as I am grateful that we've written Help Is Here, and I know it's helped some people, I know that our health system is broken when it comes to really caring for patients with dementia and their families the way they should be in all places. So this is where the age-friendly health system, the M of mentation, is in large part how we can do a better job of helping patients with dementia and their families. And so the book was a first step, but now that we're more on this journey with the senior health program and this age-friendly movement, I am my team on what we call a dementia care pathway. And you made a reference to this earlier, Kelly, but we are collaborating with PMG and with our partners at Providence to begin to think about how can we really transform care, which means how can we support our clinicians to recognize dementia earlier, to have tools they need to treat and support it, and to make referrals when they need to. And right now the care is inconsistent and we want to make it better. We also got that unbelievable gift of the $400,000 that you mentioned earlier, which just is amazing to me. But that money is going to be used for us to replicate an initiative from UCSF, the University of California at San Francisco, because they've pioneered a program to support families that I want to do in Providence, Oregon. Families don't always need to talk to a doctor when they have a problem with a person or a loved one with dementia. Sometimes the person is refusing to bathe. You don't need a doctor when you're trying to figure out how can I help them bathe? You might need a social worker. You might need a nurse with special expertise. We are wanting to develop this program to help families get connected to the right people, whether it's at Providence or in the community, and that gift is going to help us.
Wonderful. Just as an aside, Marion, I would say that in my 17 years at Providence, helping fund and develop the Here book, and then all the accompanying things you've done with it in Spanish language, getting it online. It's actually been one of my proudest accomplishments. And just to see something go from its idea stage to what you and your team have been able to do with it has been just so rewarding. And to know that philanthropy has played such a key role, I'm really excited to hear what you're going to do with this dementia care pathways. So it's going to be a lot of fun to watch. You have really leveraged philanthropy in a big way with your team. So thank you. I want to move on to another M now.
Sure.
A lot of us worry about medications. There's lots of questions about it. There's lots of concerns. Dig a little deeper into the M of medications.
Yeah, sure. Well, I bet everybody listening to this broadcast has one thing in common, that they don't really like taking medicines, right? Medicines are a big part of what we do as doctors. We're trained to write prescriptions. That's a big part of how we're trained. But the age-friendly health system turns the whole idea of medications on its ear. Rather than about adding medicines, it's about how can we take medicines away from our seniors, which is the concept of de-prescribing. And so medication is really important because, Kelly, we know that about 30% of emergency room visits for seniors is because of drug side effects. We know that about 10% of hospital admissions for seniors is because of medication-related problems. It's a big deal. And so what we're trying to do with the M of medication with the senior health program is to train all of our providers as best as we can how to look at these medicine lists of your patients and say, wow, that medicine might be safe for a 50-year-old, but it's risky in an 80-year-old. I need to think about taking that away. Or, maybe this medicine was started 5 years ago during a hospitalization. Do they still have that problem? Do they still need it? So the M of medication is to look at that. Through philanthropy, through the foundation, we have been really blessed recently in our program to have a gift to start what we call a geriatric pharmacy residency. Now, I'm a geriatrician, but pharmacists are very important with medications, obviously, and there's a pathway for a pharmacist to become the equivalent of me. They become a geriatric pharmacist. They're specially trained in medicines for older adults. There are only about 7 programs in the country, Kelly, that have special training for pharmacists in geriatric principles. And the foundation has just given us the gift so that we can start a program. So we'll be like number 8. And we're going to launch that next year. It's a year-long training for a pharmacist to do with our very talented crew, chiefed by Sharon Lee in the senior health program, to give them the training they need, which then they can go out and teach other pharmacists who work under them or wherever they happen to be employed. So again, just really exciting.
Super. I'm going to jump on to our next M, and I think all of us dream of leading an active senior life. I mean, we want to retire and be able to to get around, do the things we want to do. But I know that mobility issues do arise, and they arise often. So talk about the M of mobility and what Providence Senior Health is doing to address that M.
No, you're so right. And I talk to my patients in my practice. I think the thing that almost universally they value the most is their independence. And when you can no longer get around on your own, you're not independent. And so mobility is really, really key. I bet everybody on this call also knows at least one senior who's had a fall. Falls are really, really common. The statistics say that 40% of people 65 and older fall every year. And at Providence, if you go to our emergency rooms and you look at the data, 10% of ER visits for seniors in our 8 Providence emergency rooms across the state are for a fall, which means it's a bad fall if they go to the emergency room, right? So the M of mobility is really trying to not only focus on how do we keep our seniors more independent, but how do we help reduce their risk of falling. And I have a wonderful colleague, Colleen Casey. She is a national expert in falls, and she has been helping us develop a very robust fall prevention or fall risk reduction program. The way the foundation has helped us in particular is to help support community classes that we've now done for the last 4 years. Every fall, I know that's a little bit of a corny joke, but every fall, in fact, yesterday was National Fall Prevention Awareness Day. It's a national holiday, if you will, for those of us in geriatric medicine. But we've had these classes around this time for the last 4 years that are out in the community to help people understand how they might reduce their risk of falling. And those classes are 90 minutes. They've been funded by donors. We've had a lecture by a physical therapist on how practically you can get some tips in the audience to reduce your risk of falling. We've had a pharmacist present at the classes to go over with each person attending their medicine list, what medicines might be a little risky that you could talk to your doctor about. And we've also had a Tai Chi instructor. In fact, the picture here is of a Tai Chi instructor at one of our classes who was giving them a little 15-minute exercise on what Tai Chi is. And why that's important, Kelly, is Tai Chi is one of the few things that we know really reduces your fall risk. If you do Tai Chi regularly, you can reduce your fall risk by 50%. It's incredible. So we've done these classes. They've been really well attended. We've had over 1,000 people. This year, unfortunately, they've had to be virtual, but still we're very grateful that we can partner with the foundation to do these.
Okay, so when you opened your 4Ms, you talked about this kind of the stretch M that starts really with a W, but it's what matters. Now, I've heard you talk about mentation. I've heard you talk about medication. I've heard you talk about mobility. Those,
Yeah.
But there must be more. I mean, what matters beyond those three, or what matters? Tell me about the fourth M of what matters.
Right. Wow. Well, I could have started with that. And sometimes I do when I have conversations like this, because it really is the linchpin of the 4Ms. So what we've learned, and what I think everybody listening probably knows, is that sometimes seniors get too much care that is either burdensome or even traumatic, particularly in the last years of life. And we know that also that care can sometimes be avoided if we have done the work up front of having a conversation with that patient, with that person, to really understand better what they care about, what they value. For instance, some patients have told me that the most important thing in their life is their dog. And they want to be sure that if they get too sick to care for their dog, that we've helped them think about how they can make arrangements for that. Or if I can't walk anymore and get into a boat and go fishing, then I really need to think about how I might want my care different to be, because life won't have the same meaning for me. So unless we have these conversations and really explore what matters to somebody, not just kind of, treatments like life support can we do or not do, but what they really care about, what gives their life importance and joy, then we've not done enough. And we need to put those conversations into the chart so that other people can find them later, so that those values can live on, so that other people can see them and apply them as they make treatment decisions. I've heard from our doctors and nurse practitioners and other clinicians that we've trained in the 4Ms, that once they've really had that aha moment of, oh, now I understand, this conversation is going to help me with all of the other M's. It's going to help me tailor everything that I do for this patient. And that's true. And so we can avoid burdensome treatments that we know deep in our heart maybe won't help. But if we understand better what the patient wants or doesn't want, then we might not send them to the emergency room or the hospital. We'll have them be at home with their family, as they might wish, if we've really seen that they're too sick now to get better. So the what matters M is complicated, but really not so complicated. And yet we often need, as clinicians, a push from our patients to perhaps open this conversation up. So I implore everyone who's on this call today to perhaps take the initiative themselves to talk about this with their primary care provider if they've not had this conversation. It only can help us help you. And with the senior health program over the last few years, we've been trying to help our clinicians with even what questions to ask to get these conversations going. We've developed some tools. We call them the What Matters Questionnaire, to guide them.
That's interesting. I was just going to ask, and then you said it, you have that conversation with your primary care physician too, because this is not strictly a geriatrics discussion. I'm curious, is the fellowship program you talked about earlier strictly for geriatricians, or have you had other clinicians involved as well?
It's strictly for primary care providers, and we've had both. Yeah, for family medicine and internal medicine, either one. And we've had nurse practitioners and physicians, but it's strictly for primary care. Yeah.
I'm sure you mentioned that, and I'm sure it just went over my head, so sorry about that. Thank you.
No worries.
Hey, Marion, you've done such a fabulous job in tying in philanthropy throughout this entire discussion, but maybe you could just kind of tie it up with a bow with philanthropy on what kind of an impact philanthropy has had on your program, your senior health program.
Well, Kelly, it's hard for me not to talk about philanthropy through this entire discussion because your foundation, Providence Foundations of Oregon, support, we recently calculated this, 70% of the work in senior health between salaries and our actual projects, our work. And it's just amazing to me just how we could not do what we do without you guys, donors that have given so generously to the foundation. My journey with the foundation started with Help Is Here in 2010. I really hadn't worked with you all before. And we have touched so many people through the help of the donors and the foundation support. Senior health would not be around without the foundation. So thank you.
Well, you're very welcome. Such important work taking place, and Providence Senior Health and our donors really do make all the difference. So that is really all the time we have for today, unless I'd like to ask Marion, do you have any other final comments at all that you'd like to make as we conclude today? Just really appreciate your involvement and being willing to come on today, share with what we hope is a large audience out there listening.
You know, I think that for any of you who've learned something today that resonates with you, and what I love about the 4Ms is that they resonate not only with clinicians when I talk about them, but also with lay people. So if you've heard something today and you're like, wow, maybe I need to go talk to my primary care provider about my medicine list and go over it in more detail, or maybe I'm struggling with something, whether it's anxiety or depression, and I just really haven't talked about it. I hope today motivates you to do that, because that would be very rewarding to me, that your health could be better through this conversation.
Wonderful. So now that is all the time we have. If you have questions you'd like answered, please feel free to email them. Again, that address is foundationevents@providence.org. It's all one word, foundationevents@providence.org. We'll be following up and continuing this important conversation through our email communications. And if there's a reason we need to get in personal touch with you, we'd be happy to do that. Also, if you'd like a special senior health program packet, you can email that same foundationevents@providence.org, and we'll send a packet to you either via email or good old-fashioned U.S. Postal Service with information from today's presentation, as well as tip sheets to help you and your loved ones live a healthier life as they age and cope in these strange COVID-19 times. Once again, really heartfelt thanks to Dr. Hodges for joining me today to share such important information on all Providence is doing to improve the lives of seniors. I know we all appreciate your expertise, and I certainly learned a few things that I will carry with me well into the future. The Providence Senior Health Program is only possible, as we've said, because of the generous support of donors. In fact, listen to this statistic. 70% of the program's support comes from philanthropy. 70%. This program doesn't continue without the support of our donors, and so many donors out there know that aging is important and senior support is important. If you'd like to learn more about how to support those important senior health programs at Providence in Oregon, visit providencefoundations.org/senior health. So thank you once again for joining us today. I've just enjoyed this conversation. I've been honored to be a part of it. So thanks again. Stay safe, stay healthy. Have a great day.